We call this as Advanced Fertility Center, and it's an infertility setup. And we started in the year 2004, October 2004, and we've been running this very, very successfully over the last 10 years now. This is Dr. Varsha Samson Roy, and she's the scientific director of the place who deals with the embryological aspects of an IVF. See, an IVF primarily has a the clinicians work and the role of the embryologists. So it was a venture, a very, very daring venture, and a very challenging venture that we went into in the year 2004.
So when I came back from Singapore after my degree in clinical embryology, I had the options of being either a clinician or an embryologist or doing both together. But I was very clear that I had to choose between them, and I opted to go to the laboratory side because I always believed that is the side that is going to actually bring in the advancements in this field of infertility. And today, 10 years down the line, I wouldn't be wrong in saying that that is where infertility and all the future advancements in infertility are heading towards. It is more towards the laboratory side than the actual clinical side. That is where I met Dr. Nirmala, and 2 years we were good friends. We were working together for one of the center, I on the laboratory side, she on the clinical side. We realized that we shared the same passion. Every case that was not successful was something we sat down and discussed. We debated about it, and there was so much to learn from her end, and she was equally eager to know what is it on the laboratory side that you could do differently. What do you think went wrong there? And so we over time we understood that both of us shared the same passion, and if both of us got together, it would be wonderful. Yeah. So it was with this big dream that I started off. No much like Dr. Nirmala said. We did not have that strong a financial backing. We were fortunate to get those loans from the banks. Our families were our biggest support. And like she said, she held my hand, and we walked into this together.
Of course, there were little teething problems as far as the work was concerned, though there was a patient outload was, the input of patients was very, very large. In fact, the demand of our time and work, was very, very challenging at that point of time. And we didn't have this kind of a foresight actually when we started. This is the same building, it's a leased out building where we started. We only had occupied about 2,000 square feet area, and we had put up a very good lab that we had done, and beautiful interiors, and we started. We didn't even think that within a year or so that we were not going to have place in the OPD for patients to sit. I was practicing earlier, I was working in a center, at the same time I had my own evening practice, and I used to see about 10 patients or maximum 15 patients a day is all what I used to see in my practice. But then the practice picked up so rapidly that I started seeing almost 80 to 100 patients a day. So it used to be like about 10 new patients a day. And within, by the end of 2008 or 2009, the total number of registration of new patients into this unit touched 5,000. The first right decision that I actually took, what I feel is holding Varsha's hands. According to me, that's the right thing that I did, because embryologist is she forms a very, very major role and a very important role in this IVF setup. And the second thing I feel what I did right was to having taken this big risk. It was a very big risk on me at that point, with no support to take that loan and to move ahead, and that was the biggest risk, and very, very grateful and thankful to the divine for that decision. The very famous proverb it says, while in Rome, do as Romans do. And so when people are all moving into the area of large marketing, pouring money into marketing and such kind of strategies to create awareness so that patients walk into your place. Maybe that is one thing that we didn't think about, we didn't give importance. We were so much engrossed in patient and doing the right thing for patients and sitting with them. We didn't do that. So maybe that is one thing I feel as an entrepreneur that I should have looked into that and given more importance to that. There are areas where you are benefited being a woman. Like I told you, with the bankers, we had our way easy out, and there's always a little soft corner that it's a woman who's, dealing with us. You know how many a times the questions which come from bank and so many things, there were always a soft corner. The questions were a little subdued and they were soft with us and they were nice to us and lenient in so many areas. So there are these kind of areas where you have your advantages of being a woman, but there are disadvantages also, when talking to vendors or trying to negotiate costs on something. And I feel the attitude that people carry is, okay, she's a woman and we can take her for a ride, but I think we surpassed all that. We were not less than a man in any way, and I think that's one name that I've earned, that Dr. Nirmala, she's very tough and she's my babies. Just if you walk down our corridor and you happen to have a look at the board over there with so many babies, and I have got bundles of babies. Unfortunately, I have to have a still more larger place to put the babies all over, and that number of babies that we have delivered over this last 10 years of opening this unit, and that gives me immense joy. Future always goes like, when you realize that you have done something, you have not done something, then obviously the resolution that I have taken for this year, I have to correct what I have not done in these past years. So I need to reach out, I need to expand, I need to reach out, I need to grow and pass on this benefit that we are trying to practice, very ethically, very legally, that we are doing a good job, and the pregnancy rates that we genuinely carry with us. I need this to be reached out to many more people.